It's exactly 3 months since we recorded our first coronavirus cases. We started with 2 on March 12. We are now at 10,856 today, June 12. And it's only 3 months. You must have heard the popular phrase, "Kwata kwata by June, dear." We're in June. We're not dead yet, thankfully, but we are seeing our cases continuing to rise and a worrying change in attitudes by both government and the citizenry, which, if not checked, could lead us into the valley of death, literally. First of all, we're not practicing social distancing. Watcher lines have literally gone back to how they were. No social distancing whatsoever. Market women continue to sell close to each other, perhaps more interested in trying to eke out a living as they push the threat of the disease behind them. And when it comes to the face masks, the least said, the better.
Go from one ear to another, while others rest around the neck. That is 30-year-old Foster Bafo, a bread seller, trying to get the attention of potential buyers. He says it is difficult to call out potential clients with his mask covering the nose and mouth.
It's down because I'm shouting A1, and if it's on, when I shout, they don't hear the A1 properly. That's why I put it down for me to shout for them to hear A1.
Even in Parliament, where people expected to exhibit strict adherence to the law and directives, especially because they are lawmakers, the indiscipline persists. In Parliament today, the leadership and the COVID-19 team were frustrated because MPs and staff who have tested positive for COVID-19 are refusing to stay home.
Speaker, you and leadership arranged for all of us to be tested for the coronavirus disease that unfortunately has engulfed this country. The arrangement was that anybody who unfortunately tested positive would not be openly identified, but that the testing team would have an arrangement to contact them behind the curtains and have the situation managed.
So why would you want to put others at risk? Why? I mean, it's also amazing that some citizens in this day and age don't believe that the deadly disease exists. Perhaps that explains why so many people are so lax about the disease. The coronavirus has claimed at least 48 lives in Ghana, and you don't find that alarming?
It's terrible. It's a challenge, and that is a call to duty by the Environmental Health Department of Accra Metro Assembly, Metro Public Health. This is not only today. We started this from the last 7th day up to today, and we are still on it. Lot is there. We persistently carry this exercise every week, and today we're burying 5 at a go. We're going to bury more. Saturday we have another burial, and it's going to continue and continue. We only want to alert the public. The COVID is there. The COVID is real. And therefore, protect yourself, observe the national protocol measures to protect yourself, protect your family, and let's protect the country image as a whole.
Well, if that doesn't shake you to the core, then watch these scenes. So we should be careful we don't reach this point. But with treatment centers getting full and health workers contracting the disease and our figures rising steadily and public education slowing down, it begs the question, are the responsible officials handling the situation as effectively as expected?
We will protect people's lives, then their livelihoods.
Mr. President, I think this protection must come fast. You gave us this assurance when our case count stood at 1,000. We are now at almost 11,000. Of course, this is a shared responsibility between government and the citizenry. But you wield the power. The lives of our fathers, our mothers and children are in your hands. Nane Kufuor, this is when we need your assured protection the most. The numbers are rising, and so is the nation's need of your protection. Real practical action and not just rhetoric.